Good morning from sunny Florida. It is 6:30 in the morning. It's going to be a beautiful day here. Sunny, about 27, 28 degrees Fahrenheit. I mean centigrade. This morning I would like to discuss with you the Ayurvedic concept for management of cancer. As you know, cancer is not one disease. It is a multiple disease syndrome which affects the whole organism, whole individual. Now, cells in normal adults have a very tight control over the patterns of growth. What that means is that as we are living, we are constantly renewing our old cells for new cells. So there is a very controlled new cell growth. As the old cell die, the new cells are formed. Cancer cells occur when there is an uncontrolled growth, when the cell undergoes a mutation. In Ayurveda, we call cancer as arbuda. Now, in order for mutation to occur, hundreds of genes have to be damaged or lost when the reproduction of the cell is going on. We produce normally cells, cancer cells all the time, but our immune system recognizes them and kills them. This process is called apoptosis. Now, what causes these genes to get damaged? Uh, the most important, which is recognized both in modern medicine as well as in Ayurveda, that free radicals produced in the normal process of metabolism, we call it ama. The carcinogens, which are radiation, chemicals, tobacco, infectious agents, and these free radicals or carcinogens cause a error in DNA replication, causing a mutation. Now, occasionally, random errors in DNA multiplication also can occur, or a inherited mutated gene can also cause cancer. And according to Ayurveda, emotional toxicity is also responsible for um, errors in mutation. So, according to Ayurveda, ama is responsible for the genetic changes through its effect on the extracellular matrix. Ama could be defined as the epigenetic changes in the structure around cells in the extracellular matrix that predisposes the cell to mutate. Now, we will not go into the entire process of pathogenesis, but we know the cause. How it causes that mutation is a subject of study, uh, which is very difficult to answer in this short period of time I'm going to be with you. But let us say that Ayurveda believes that the environmental factors, whether they're external or internal, which affect the function of the gene to produce or duplicate the DNA. So it is not the genetic disorder, but the environment in which the genes are present which causes this mutation, which is the definition of epigenetics. And some of you might have heard me talk about that Ayurveda is the science of epigenetics, because all we talk about in Ayurveda is how to improve the environment in which the genes is present. So through Panchkarma, we improve the environment in which the genes are present by lifestyle changes, by meditation, by breathing, by emotional detoxification. All these things are to do the improve the environment in which the genes is present. So let us simplify the case and divide the mutation of the cell into two types: those that result from the accident and errors on the part of person's DNA, and those that are linked to lifestyle. Now, in the past, when I went to medical school in 60s, we believed that 90% of the cancers occur because of our predisposition to cancer. That means it was inherited in some form or the other. Today, it is that it is reversed. Now we believe that 90% or more of the cancer occurrences occur because of lifestyle. So let's pursue this line of reasoning with the expectation that doing everything we can do to prevent cancer is clearly the best choice. Very highly placed researchers believe now that 90 to 95% of the cancers are preventable with drastic lifestyle changes, and only 5% are believed to be due to inherited gene which causes the cancer. Again, we developed the human biome, genetic biome, and that has not helped us much to prevent or treat cancer. So, what we consider as environmental and lifestyle factors include some of the familiar culprits: overweight, lack of exercise, poor diet, smoking, overuse of alcohol, and overexposure to ultraviolet and other forms of radiation. And if I had to divide these cancer related deaths, I think 25 to 30% are due to tobacco, 40 to 45% are linked to diet, and about 10 to 20% are due to infections, and most of these are preventable. So, wisdom of Ayurveda tells us, Yatha Pinde Tatha Brahmande, which means that the tumor progression, uh, initiation, progression, and transformation are all products of microenvironmental experiences, whether it is the food or other impressions we bring from the external environment through our senses, or the emotional toxicity, or presence of ama in the tissues, which prevents the nutrients from going into the cell, and the waste products from coming out of the cell, causing a disturbance in the Pilu Agni and the Pithara Agni, and therefore leading to um, uh, a imbalance or a mutation at the level of DNA duplication. When the imbalance occurs, when this individual develops cancer, imbalance is not in the tumor, it is the whole person. So we have to look at the whole person. In modern medicine, we kind of hone onto that particular part where the tumor is, but Ayurveda will want to look at the holistic point of view, as to look at the tumor from different angles, and I'll come to that in a minute. So, when these epigenetic factors are present, there is chronic inflammation. With chronic inflammation, cellular morphology and underlying dysfunction progressive forwards from metaplasia to dysplasia to neoplasia. So, cancer in Ayurveda is a tridoshic disease. Kapha is responsible for the growth of the tumor, Pitta responsible for the metabolism, inflammation, and Vata responsible for the uh, metastasis and weight loss, which is usually associated with cancer. The pathogenesis of cancer, Nidana, according to Ayurveda, would then be that the homeostasis is disturbed, the immunity and immune response is disturbed, the dosha are disturbed, and uh, this is what I want to discuss in the next few minutes so that we can come to a appropriate management of the cancer. So, through identification of causal factors that inhibit immune response treatments that re-establish homeostasis will allow us to use the innate power, innate intelligence of the body to manifest on a general level. If the innate strength is strong, that means ojas are good, that will permit support of the correct cellular functional communication. Now, I wanted to show a slide, but I don't know whether I will be able to do it or not. I'll see if I can. If not, I'll just describe it to you, and if you need it, I'll send it to Dr. Shah, and he can share it with you. So I've looked at a integrative approach to treatment of cancer. The causative factors, of course, we talked about: improper lifestyle, poor nutrition, environmental toxins, and emotional toxins, emotional stress. That leads to mental ama and the physical ama. The mental ama as well as physical ama both decrease the immunity. That causes cellular stress, abnormal pilu agni, pilu pak, and the pithara pak, and that leads to mutation of the tissue cell. And cancer then manifests as growth of these abnormal cells, which are not guided by the rules of the growth. Um, I talk about that these cancer cells lose their dharma, their duty to protect the entire organism. I always say that there is only one function of all the 3 trillion cells we have in our body. And the one function is, how can I help? These cancer cells lose that dharma, their duty, and they become selfish and they can continue to grow. Uh, Now, Ayurveda is excellent for prevention of cancer using these principles which we talked about of Ahar and Vihar. Increased immunity by Rasayana therapy and immune modulation. Decrease mental ama using yoga, meditation, pranayam, and decrease cellular stress by panchkarma. Now, this is all in that slide, and I'll send you that slide. The modern medicine is excellent for diagnosis and treatment of the symptom by surgery, radiation, or chemotherapy. Because modern medicine is only treating the symptom, the tumor, either by surgery, by removing it, which is essential. We need to do that. And maybe chemotherapy and radiation. But we, we won't argue the benefits versus um, bad effects of those things. This is what is available to us. Modern medicine gives us the possibility of diagnosis and then removing the symptom. Ayurveda gives us the uh, the knowledge about preventing and secondly treating the cause of the cancer, which is ama. So I believe that an integrative approach to management of cancer is the best way to go. The goal of the integrative approach is to improve the quality of life better than either one of the systems used alone, enhancing the effectiveness of conventional therapy, that means the treatment of symptom and then treatment of the cause, preventing side effects of conventional therapy, attaining and maintaining the remission from cancer for a long period of time, and then reduce the toxic burden on the body as a result of unhealthy lifestyle patterns and imbalanced dietary patterns, toxic exposures, or genetic vulnerability of the patient. So now we are treating the whole picture from the point of view of symptomatic treatment and the causative treatment. I truly believe that uh, Ayurveda gives us the best opportunity to improve the diet. And in my experience, I see a lot of cancer patients because of my background in surgery. Uh, I put them on AMA reducing diet from the time I see them. Uh, Now, AMA reducing diet in India and in US are slightly different. We don't use any dairy, no milk, no milk products, because the dairy in this country is very pro-inflammatory. And sometimes I'll discuss on that issue. Uh, I think in India it is becoming the same thing because of the industrial production of dairy products. The dairy has become very inflammatory. The casein in the dairy is very inflammatory. So a AMA reducing diet in United States is dairy free, which is vegan. But we use Ayurvedic principles to introduce that vegan diet. That means it has to be freshly cooked, it has to be whole foods, not processed foods, and it has to be cooked fresh. So those things combined, that is the first diet I put them on is AMA reducing diet. Uh, Sorry, I don't put them on sattvic diet because of the presence of dairy in the sattvic diet. Now, once we have on you change their start changing their um, load of ama in the body by reducing the ama. We also start working with them on the level of mental ama because that is a very important cause of cellular mutation. It has been shown in many studies that emotional um, imbalance will lead to cascade of neurotransmitters which go and influence the messenger RNA at the cellular level, um, which then causes a cellular mutation. So we work through yoga, through uh, pranayam, meditation, yoga nidra. There are many different techniques available to us in the yoga world to help them in that fashion. And then improve their immune system using some kind of a rasayana. I'm more concerned about reducing the ama load and let them go through that surgical procedure which needs to be done for removing the symptom. Because I believe in an integrative approach that the symptom control is best by modern medicine. And once they are finished with that surgery, then I will bring them back and take them through Panchkarma. Usually, I wait about 3 to 4 months before I institute a Panchkarma to do a detoxification program based on the type of tumor, based on the location of tumor, based on whether it is a Vata predominant, Pitta predominant, Kapha predominant tumor. And again, as you know, that in Ayurveda, we will classify these tumors based on which dosha is the primary cause of the tumor formation. Though all three doshas are involved, we start with a detoxification and balancing their vata dosha, balancing their agni, balancing removing the ama, and then maybe at a later date do a more strenuous panchkarma to remove the deep-seated ama. It has to be all uh, individually planned so that we can achieve the best uh, outcome. Now, as far as herbs to use for improving uh, uh, their ojas, we have several available. Now, as you know that for preventive purposes, we have ashwagandha, turmeric, shalaki, guduchi, uh, kalme, uh, kalonji, which is a spice, trifla. These are all used in um, different places for prevention of tumor. But in treatment, we use some of these in the rasayana form uh, to uh, improve the ojas in the person. I also believe that there are a lot of minerals which are deficient in cancer patients because the tumor or the cancer has taken up all the minerals in the body and the body is deficient in those minerals. I use Shilajit in most of my patients, which is, as you know, a very mineral rich um, Ayurvedic compound. uh, Zinc, copper, selenium, all those are present in the uh, Shilajit. So, in summary, we have a treatment of the whole individual uh, using diet to reduce ama and improve agni in the beginning, and using yoga and yoga therapy for the management of emotional ama, using rasayana therapy for the treatment while they're going through surgery and radiation and chemotherapy. Because rasayana therapy helps as an antioxidant to prevent oxidative stress caused by chemo and radiation. It is also adaptogen for tonifying the tissues. It reduces the side effects of alopecia, nausea, vomiting, constipation, anorexia, uh, which are caused by chemo or radiation, lowering the chance of myelosuppression, which is usually due to the chemotherapy and radiation. And it also has a role in its own cytotoxicity for cell recovery, increasing the apoptosis, and improving the receptivity of the chemotherapeutic agents. and augmenting immune system. These last four things I've talked about, their rasayana as a cytotoxic, cell recovery, and increasing the apoptosis needs more research in it because I don't want to make the claim that these are truly beneficial as cytotoxic. Now, we have different kinds of rasana available based on the tumor, whether it's based in amlaki, ashwagandha, purnanava, guduchi, or trifla. We have several options available. So, as far as Ayurveda is concerned, 2 points must be kept in mind in management of the patient with cancer: improve or tonify the immune system, and purification therapies or detoxification therapies to remove the ama from the body and remove the excess doshas, creating homeostasis in the body. So, when I evaluate a patient with cancer, I evaluate their lifestyle, their nutrition, their environmental toxins, and emotional stress, and then apply the principles of Ayurveda, as I said before, through yoga, meditation, pranayam, through proper exercise, proper diet, proper immune modulation, improving their agni, and using these as supportive therapy till the symptom has been taken care of, and at that time I institute panchkarma therapy to remove the cause of the tumor. Few words about prevention of cancer, which from Ayurvedic standpoint, that is the most important. Uh, Smoking, uh, exposure to sun and radiation, those two alone can reduce 50% of the cancer deaths in this country. Vegetarian diet. Now, uh, when I say vegetarian diet, I call it vegan because I don't include dairy in the diet because of the inflammatory nature of dairy. Uh, Lower levels of insulin and free insulin like growth factor in people who plant-based diet. So this is mostly a plant-based diet. Their IGF-1, which increases with vegan diet, prevents it enhances the lowering the IGF enhances the apoptosis, which is a way for the body to get rid of cancer cells. As I said, we all have cancer cells every day, up to thousands of cancer cells every day we produce because so many cells are going through multiplication and duplication that there are going to be some errors in duplication and mutation of the cell. And the immune system will recognize it and uh, kill them. Anti-inflammatory diet, which I'll send it to Dr. Shah, which I have developed for patients with autoimmune disease and with cancer patients. Uh, these are used very much in US, and then using of spices and ashwagandha uh, and trifla for prevention. So that is my presentation. Please reach me at www.mindbodywellnessflorida.com or send an email to vijay at vijayjanmd.com, and I'll be glad to answer any questions you have. I enjoyed this presentation. Thank you, Dr. Shah, for inviting me.